Hello students, welcome back to Enamel Heroes. So today we are back with very important topic, that is OSMF, oral submucous fibrosis. It is very important for your Viva point of view, for your NEET point of view, as well as for your professional point of view. I mean for the long answer note. So this is very important for your NEET, for your Viva, and for long question in your professional exams. So the contents that will be included in this topic are the definition, etiology, differential diagnosis, and the treatment plan. So now let's see what is basically OSMF. So it is potentially malignant disorder, and there will be a development of the ulcers in the patient of the OSMF. This is a very serious condition and it will result in converting to malignancy. Okay. Now the definition, it is J.J. Pindborg and Sirsa definition, which is given in 1966. So whenever you are asked about the definition in your Viva or in your examination, I mean in your professional exams, you are supposed to write as it is. Definition. You cannot modify the definition in your own words. So this is very important. Like, you have to write the definition, you have to quote the definition as it is. Okay, so now let's see what is the definition. It is an insidious chronic disease affecting any part of the oral cavity and sometimes the pharynx, although occasionally preceded by or associated with vesicle formation. It is always associated with just a epithelial inflammatory reaction followed by fibroelastic changes of the lamina propria with epithelial atrophy, leading to stiffness of the oral mucosa and causing trismus and inability to eat. So this is the definition that you're going to quote. Now let's see the etiology. It includes areca nut followed by tobacco chewing. Okay, so these are the etiology that is responsible for OSMF. Areca nut chewing followed by consuming tobacco, and the third is chilies. I mean eating very spicy food, because chilies have a pigment called capsaicin that is responsible for aiding in OSMF. So now let's see in areca nut. Areca nut, it has a alkaloid called ericoline, and because of the presence of this alkaloid, what it does, it stimulates fibroblast formation. It stimulates the formation of the fibroblast. So when fibroblasts are formed, they cause formation of the collagen fibers, and the formation of the collagen fiber causes fibrosis, means formation of the fibrous bands, and these fibrous bands, they cause stiffness of the buccal mucosa, and this stiffness of the buccal mucosa called, what it is called? It is called blanching. The stiffness of the buccal mucosa is called blanching. Okay, so I hope the etiology is clear. First of all, it includes areca nut chewing followed by tobacco, and third is the eating spicy food, that is chilies. It has a pigment called capsaicin, and it is responsible for aiding into OSMF. Now let's see. So as I have explained you about the epithelial atrophy, the epithelium get atrophied because here in the definition it is mentioned leading to epithelial atrophy. Okay, so the same thing is representing here also. There will be atrophy of the epithelium. Now these purple color dot structure, these are the lymphocyte. These lymphocyte cause chronic inflammation, and because of the presence of the lymphocyte, and these lymphocytes are responsible for causing the inflammation, they cause burning sensation in the patient. They cause burning sensation. Now this green color structure, these are the fibrous bands, these are the collagen bands. So because of these collagen bands, collagen fibers, as I have explained you, collagen fibers, it cause fibrosis, and because of this fibrosis, the formation of the fibrous bands are formed, and these fibrous bands cause blanching, that is stiffness of the buccal mucosa. Okay, so blanching, how it appears. marble like appearance because of the constriction of the blood vessels. Okay, here the blood vessels, because of the lymphocytic infiltration, the blood vessels, they get constricted, and because of the constriction of the blood vessels, it appears like a marble like structure, the floor marble. So it exactly represents like that. Okay, the clinical feature, the how clinically OSMF look. So it appear like a marble like structure, which is called blanching. So if blanching occurs, then it will lead to stage 1 OSMF. Now let's see what will be the signs and symptoms of stage 1 OSMF. Sign and symptoms. Normal mouth opening. Mouth opening is normal, that is 40 mm, and there will be only mild burning sensation. Okay, so mouth opening is normal, that is 40 mm, and mild burning sensation will be there. Now let's see what is the treatment plan for this if the patient has diagnosed with stage 1 OSMF. First of all, we have to counsel the patient. Counseling, I mean counsel the patient to quit tobacco. Okay, then for mild sensation, as I've explained you, there will be the mild burning sensation. So for mild burning sensation, we'll give topical steroids, that is 0.1% triamcinolone as acetonide. Okay, for blanching, we'll be giving vessel. What is blanching? Constriction of the blood vessels. So if the blood vessel get constricted, so for that we'll give vasodilators, in order to dilate the vessels. Okay, so what vasodilator does, it increases the blood flow. Okay, so now let's see what are the vasodilators that we give. We give pentoxifylline 400 mg for 15 days. Then we give xantinol nicotinate. It can be given as intralesional injection with the help of insulin syringe wherever blanching is present. Okay, so wherever in a oral mucosa, wherever there will be a branching, you see the clinical sign that is branching, you can give these xantinol nicotinate injection. Okay, intralesional, in the lesion you can give. So now if the patient neglects stage 1 also, then this stage 1 OSMF will be converting to stage 2 OSMF. Now let's see what are the signs and symptoms. What are the signs and symptoms of stage 2 OSMF? So they will be blanching. There is already blanching present in stage 1. Then there will be burning sensation in stage 1. There was a mild burning sensation. Here the intensity increases in stage 2. In mouth opening, in stage 1 the mouth opening was normal, that is 40 mm, but in stage 2 the mouth opening reduces to 30 to 40 mm, and minimal bands palpable. There will be palpation of the certain bands. Watch which bands? Fibrous bands that I was talking about. Fibrous bands, they will be palpable. Okay, so now when we come to stage 2, what are the things that we'll be seeing? We'll be inspecting, of course, about the mouth opening. Tongue protrusion, there will be protrusion of tongue or not. Blanching, we'll see for the blanching. And then we'll see for the alva. It gets hockey stick appearance. It take hockey stick appearance. So we'll be looking for alva. How about the shape of the alva? So the shape turns to hockey stick appearance. And then we'll be palpating vertical bands. Here these are the same bands that I was talking about. So in stage 2, these vertical bands are palpable but very minimal at stage 2. Okay, now if patient does not get proper treatment at stage 2 also, then this stage 2 converts to stage 3 OSMF. Now let's see what are the signs and symptoms of stage 3 OSMF. There will be blanching, of course, burning sensation, the intensity will be increasing. There will be more blanching, and the mouth opening has reduced. Earlier in stage 2 it was 20 to 40, but now in stage 3 it is just 20 to 30 mm. Okay, vertical fibrous bands, they are palpable. They are clearly palpable in stage 3. Tongue protrusion is restricted, so there will be restriction of the protrusion of the tongue. Alva, it become hockey stick shape. So these, every point, every word which I'm telling you in this video through this PPT is your NEET question. Every pointer is your NEET question. So my students, I'm requesting you to focus here. Each and every line, how much mouth opening is there, what are the bands, if it is palpable or not, what happens to the tongue protrusion, at which stage there will be restriction of the tongue protrusion, what is the mouth opening at stage 2, what will be the mouth opening in stage 3. So all these points are your NEET questions. They can come in any form. Okay, so be focused. Now let's see what are the treatment plans for stage 2 and stage 3 OSMF. First of all, we'll counsel the patient to quit the habit. Okay, then we'll ask for the diet modification. We'll go for the diet modification, and we'll ask the patient to take antioxidant rich food, which is rich in vitamin A, vitamin C, and vitamin E. Patient can take tomato paste. Tomato paste or tomato puree, both are same. Why? Because it contain antioxidant, that is lycopene. Patient can take black tea. So these are the certain diet modifications. These are the certain vitamins, antioxidant that patient can include in their diet. Okay. Now we can prescribe antioxidants like tablet Nanomin XP. Then very important, that is physical exercise. Physical exercise is very important. Fourth comes as a physical exercise, that is mouth opening exercises. For mouth opening exercises, what it does, it basically breaks the collagen bands, the bands, that the fibrous band that have been formed in the mucosa. So it basically breaks the collagen bands. And there is an instrument that we use in our clinic, that is Hister's mouth gag. So it is basically used to break the collagen bands. Now let's see what are the physical exercises that we do. First is the ice cream stick exercise. So what we do in ice cream exercise, we ask the patient to keep ice cream stick in your mouth, and gradually we keep on increasing one by one. So in order to see if there is a increase in the mouth opening or not. So gradually we add one at a time, one ice cream stick, and then after some time we increase one more ice cream stick. So this is how the ice cream stick exercise does. And the second exercise is the cheek blowing air in the cheek. So second is the cheek blowing exercises. So these all are the physical exercises that we advise to the patient in case of OSMF, along with the counseling, diet modification, and prescribing antioxidants along with the medication. Now fifth, we can also give intralesional injections. Now let's see what are the intralesional injections. So we can give corticosteroids and hyaluronidase enzyme, and the dose of this enzyme is 1500 IU. Okay, in corticosteroids we can give Dexa 4 mg, triamcinolone 40 mg. Okay. So this treatment is given twice a week for 2 to 3 months. Okay, so we are supposed to give this intralesional injection twice a week for 2 to 3 months. Along with it, patient should supposed to do mouth opening exercises. Okay, along with the treatment, the physical exercises must. Okay, so there is an alternative for this treatment also. We can give corticosteroids along with hyaluronidase, plus we can give placental extracts also, and this is given for 2 to 3 weeks. Okay. So now if patient neglects its OSMF condition at stage 3 also, then it is converted to finally stage 4 OSMF. So what are the contrasting features at stage 4 OSMF? So mouth opening is highly reduced. It is now even less than 20 mm. At this stage, there is no medicinal treatment. You cannot give intralesional injections or use Hester's mouth gag. We can use, but that is not effective at this stage. So the only possible treatment at this stage is a surgery. We should go for the surgical treatment. Okay, so this is all the stages: stage 1, stage 2, stage 3, stage 4. What are the signs and symptoms at the particular stage? What will be the treatment plan for a particular stage? What are the medicines? How you're going to counsel the patients? What will be the diet modifications? So these are all very important, and these are the things that you're supposed to include in your answer when you are going for your profession, and when you are writing this question, when you're attempting this question in your long note form, long answer form. Okay, now let's see what are the DD, that is the differential diagnosis. It can mimic anemic stomatitis, scleroderma, and radiation fibrosis. So these two are the autoimmune diseases, anemic stomatitis and scleroderma. Okay, so that's it for this video. I hope I make your points, I make your doubts clear, and now the topic that is OSMF is clear, I mean, you understood the topic well. So thank you so much, and I'll be meeting you in next video.